Oxygen as a service providers we work with in Nigeria, Uganda, Kenya, India, and Tanzania have improved oxygen availability, patient care, and cost predictability across a variety of settings. However, scaling these services is challenging, as they are operating in contexts where oxygen systems are complex and often fragmented. We are here to share some lessons we have learned from this group of businesses and to highlight how these services can be tailored for context and adapted for wider impact.
At Adaptable, we do not believe in one-size-fits-all approach for our hospital partners. For this reason, we have different pricing models for our varying facility types, where these hospitals can choose what price fits their unique needs.
An important part of building a sustainable oxygen as a service model is determining the price of your package and how facilities will pay for it. In other words, it's not only about offering the right equipment and services. The price and payment model also need to reflect the financial realities of the health facility you are serving. Let's look at 3 common approaches. First, there is a subscription model. This offers facilities a simple, predictable monthly fee. It can make budgeting easier for both the facility and the oxygen service provider. But many smaller or lower level facilities hesitate. When patient numbers are low and oxygen demand drops, paying the same fixed amount can feel unfair, even if the cost balances out over time. Subscriptions also present a challenge for oxygen service providers. Because payments aren't linked to actual oxygen use, there's little financial incentive to invest in activities that grow demand, like clinical training or pulse oximetry. Another option is usage-based pricing. Facilities pay only for the oxygen they use each month. For smaller facilities, this can feel more familiar and flexible, but it also creates uncertainty for oxygen service providers. Without a predictable income, it's harder to plan or invest in the long term. That's where flexible hybrid models come in. These combine a small base fee with usage-based charges. They can ease concerns for facilities while offering more predictable revenue for providers and stronger motivation to invest in services like clinical training and diagnostics, which ultimately lead to increased oxygen use. The right model depends on many factors: the size of the facility, patient numbers, available budget, and the autonomy that procurement teams can have to make new purchasing decisions. But when pricing reflects the reality on the ground and supports both facility needs and the service provider's sustainability, it helps create conditions for reliable, long-term oxygen access.